Hi, welcome to Health Talk with Dr. Akram. I am Akram. In this program, we will be talking about all kinds of different health issues with different experts in the field. Today, we will be talking about prostate and prostate-related problems. So sit back, relax, and enjoy your time with us. The prostate is an organ in male reproductive anatomy. This small gland sits directly below the bladder and plays a role in producing a fine-tuning semen. It is an accessory gland found only in some mammals. It differs between species anatomically, chemically, and physiologically. The prostate has various functions. The most important is producing seminal fluid, a fluid that is a component of semen. It also plays a role in hormone production and helps regulate urine flow. Prostate problems are common, especially in older men. The most common problems include inflamed prostate, enlarged prostate, and of course prostate cancer. Symptoms of prostate trouble often appears as difficulty urinating. The prostate is not essential for life, but it is important for fertility. The word prostate comes from ancient Greek, meaning one who stands before, protector, or guardian. The prostate was first formally identified by Venetian anatomist Niccolò Massa in 1536 and illustrated by Flemish anatomist Andreas Vesalius in 1538. Prostate cancer is one of the most common cancer affecting older men in the UK, US, Northern Europe, and Australia. It's kind of quite similar to breast cancer in ladies, and a significant cause of death for elderly men in worldwide. Often a person does not have symptoms when they do occur. To understand more and learn about it, let's welcome our special guest in the show, Mr. Tariq Tasaddaq, who is a consultant urologist working in Bedford Hospital in the UK, who has immense experience in treating patients with prostate conditions. Tariq, how are you doing today?
Thank you very much. Thank you, Akram, for inviting me for this nice seminar. And I'm happy to be here with you. And I'm quite happy to answer any questions that you may have or the audience may have regarding this important topic.
It's my pleasure to have you in the show. I remember we both met first time in Sudan, isn't it?
Absolutely. That was, I think, about 6 years back.
6 years back. Actually, we both went there to do some voluntary work. How do you call it? It's some charity work, isn't it?
That's right, with the Salamat charity, which is a London-based charity, and we did a lot of prostate procedures there as well.
Prostate procedures, and that's the time I met you, and you are a great surgeon, Tariq.
Thank you very much.
I have seen, because
you're very kind to say that.
As anesthetists, we sit behind and watch these guys operating. You know, we judge people, and you're one of the best surgeons I've seen.
That's very kind of you, but I mean, I still have regret. You didn't join me for scuba diving in the Port Sudan, which is a nice corals and nice area there.
Oh, Port Sudan, okay.
That was where we met, so that was.
Yeah, we should go again anyway.
That's right, definitely.
Anyway, we did lots of prostate surgeries in Sudan. Okay, before we start the show, please tell something about you. Who are you?
I'm a consultant urological surgeon. I'm currently based at Bedford General Hospital, and I was trained at the University College London Institute of Urology. It used to be at the Middlesex Hospital at that time, but it's moved to the new campus, which is opposite the Euston Station. You can see the 5-star building there. So that's where I trained. And then I've had the opportunity to work in different parts of the world. And I've been to America, I've been to Middle East, and I've done volunteer work in Africa and Asia. So I've seen the different aspects of urological problems, and especially the different treatments for prostate problems as well.
The prostate is a common problem, isn't it? As I said in my intro speech, it's kind of equivalent to breast cancer for ladies, isn't it? But it doesn't get that much of attention.
That's right. The problem is that men are very reluctant to bring their problems forward. And the only time people felt about prostate was that somebody could not pass urine. So I remember, the only time a patient with prostate issues comes to hospital when we started training in the last century was when they could not pass urine and they had to have a catheter fitted in. And the other symptoms like having to wake up in the night, slow stream and other issues, people thought that's just a part of normal aging.
Normal aging.
And they didn't seek any attention. And many times even now, it's the women who bring their husbands to the hospital, that they disturb them in the night, they have to go to toilet more frequently.
That's a good point, Tariq, because I have a lot of women viewers as well, and please don't close your TV sets, because this is really important for you as well, to identify your partner or your somebody in your family, maybe your fathers or grandfathers who will have this prostate problem. Anyway, this is a live program, so call us on 0203 515 5788 if you have any questions or suggestions, or write to us healthtalk@intv.co.uk, and you can also follow us on Twitter and Facebook, Iron Health Talk with Dr. Akram. And of course, you can watch us on Facebook Live and our special dedicated YouTube channel, Health Talk with Dr. Akram. If you haven't subscribed yet, don't forget to subscribe, because there are lots of updates coming, especially with our Iron TV programs. Anyway, Tariq, back to the show. Okay, let's talk a little bit about what is this prostate is about. What are we talking here?
As you mentioned in your introduction, it's sort of an accessory prostate, and even when you remove the prostate for prostate cancer or other diseases, people carry on living. So it's a gland sitting at the base of the bladder, and the water pipe goes through it. So as men get older, the prostate's enlarged, and this the urine tube which goes through it gets constricted. So that puts pressure on the bladder as well, and the first symptom is that when they pass water, the stream is not as good. Then when it gets bigger, that starts causing problem for the bladder as well. Bladder doesn't empty very well. They're more liable to get infections, and in later stages it can even affect the kidney function, because kidneys can't drain, and sometimes the presentation of a prostate problem is with impaired kidney function or kidney failure.
But as I imagine, if you think the bladder as a reservoir, and the water is going out from there, and the prostate sits just underneath, isn't it?
Yeah, absolutely. That's right. Yeah, it's a sort of a valve at the bladder, and one part of the prostate does play as a valve as well.
So it plays as a valve.
As a valve, and especially for when men when they have ejaculation, the valve closes so that the ejaculate, which comes through the prostate, goes out through the urethra. It doesn't go back into the bladder. And people who had prostate surgery, we warn them that after this operation they won't be able to produce more children, because the valve that stops the semen going into the bladder is not there anymore.
All right.
So it goes into the bladder, and then it's drained with urine. So it's called a genital sphincter as well. And the prostate, as it gets bigger, as I mentioned, the tube gets constricted, and the flow is reduced, and slowly the bladder gets distended. And bladder, then there are changes due to obstruction. There are changes in the wall of the bladder, which becomes thickened. And
so generally, in normal life, in a young person, they won't even know there is
the prostate
something
exists.
called prostate,
absolutely,
isn't it?
absolutely.
So it starts troubling you.
It starts in your the fourth or fifth decade of life, and as you grow older, the incidence of prostate issues starts getting more.
Right. What's the reason? Why does it grow?
It's due to the multiple factors which are responsible for it, but the main thinking behind it, and most of the research has shown that is because of the imbalance in hormones. So, I mean, the testosterone secretion reduces as men get older, and the other hormones, the estrogen and others.
So the testosterone keeps it smaller?
The testosterone, testosterone secretion is the balance between testosterone and other hormones, and that the hormones imbalance.
The hormone imbalance which makes it grow. So in the young age, they have everything is normal.
Is normal, and as they grow older,
so is it like everybody? Every male in certain part of their
varies,
life, they will get it?
It varies with different men, and they grow it, prostate grows at different rates. And the other thing important to remember is that it's not always the size of the prostate that causes the problem. We can see prostate as big as a small orange, which caused no problem. And you have a small prostate which has got more fibrous content.
So generally the prostate is like a small ping pong ball size, right?
It would be probably like a walnut, small walnut.
A walnut, okay.
Walnut. So that's the normal size, but sometimes it goes outside, so it doesn't cause that
it doesn't cause the obstruction.
Yeah, so if it goes inside and it's got more fibrous tissue, it can cause more blockage as well. So it's the size of the prostate, although is important, but it's not the only factor that affects the flow of urine.
So the first symptoms we get not because of the prostate. The symptoms are due to the
symptoms
urine outflow.
That's right. The two symptoms we we classify them in two types of symptoms. One is called the obstructive symptoms. That means that the flow is reduced. Patient has to wait a few seconds before he can start a micturition, and when he finishes urination, he still has some desire that some urine is left behind.
So the bladder doesn't empty
completely. And the other is we call the secondary symptoms of prostate, which affects the bladder, and that is called storage symptoms. That you may have frequency, going to toilet more often, waking up in the night. And sometimes you have an urgency. You can see men, you're looking for toilet, so with an urgency, a normal person can control the urine as long as they want. But people with enlarged prostate or who have secondary effects of prostate have to rush to toilet, otherwise they may wet themselves.
So if you have this kind of symptoms, will you think about some other illness as well? Or will you?
These symptoms can be due to other illnesses as well if there's some neurological issues. But if a healthy person which has got no other history, or simply the first thing that comes to mind is the enlarged prostate or the prostate causing the problems.
So can I say that, my prostate is aching, will I have prostate pain at some point?
That's quite common, you mentioned rightly, because in the young men, the prostate problems are due to inflammation, what we call prostatitis. And it affects about 10,000 men in the UK every year. So it's quite common, and for young men, it is common. It is
infection or inflammation?
It is inflammation of the prostate, and initially it's caused by infection, but not always we find an organism for it. So it's sort of a bacterial and non-bacterial prostatitis, but that's quite disabling for young men because it causes a lot of discomfort, pain, and especially pain during ejaculation, which is quite disabling for youngsters.
So if they have these symptoms, it's better to seek medical help?
Absolutely. The physical examination would be is useful because you can examine the prostate, and it's on examination it's a bit tender to touch. And then sometimes you can find the organisms, and if you do the specialist test. So
can you repeat again this prostate pain? I just want them to,
prostate pain is a pain which usually affects young people. It's pain in the perineum behind the scrotum and between the back passage and the scrotum. That's the area. So it can affect urination, which can be painful. Ejaculation can be painful because the ejaculated fluid comes through the prostate. And generally people can come present with fever as well, being unwell because if there's a severe infection going on in the prostate. So it's quite a disabling disease when it's full blown. But some patients may have mild symptoms. So it's a spectrum of symptoms.
And do they come straight to a urologist or they go to the GP first?
They don't always. They go to the GP. And even not all patients go to the GP, and they may think that there's some other reason. And they sometimes end up in STD clinics to be screened that it may be the symptoms of a sexually transmitted disease.
Sexually transmitted disease.
Yes. And the important thing for general practitioners is as well that they need to examine.
So this is for the young people?
Young people, yes.
And for older men, when they get enlarged prostate, will they have prostate pain as well?
They can. The prostatitis doesn't always occur in young people. It can happen at any age.
Enlarged prostate doesn't cause pain?
Enlarged prostate per se on its own does not cause.
So even if a cancer building up inside, it will
even
not
with cancer unless it's advanced and it's going outside the prostate or affecting the nerves around the prostate, it's painless. That's why all the new method of screening program for prostate cancer is when we need to pick it up before it becomes symptomatic or painful.
So that's why it is important, especially in older men. They will be living their normal life, and this prostate is growing underneath like a time bomb, and they don't realize it's growing.
Right, yeah. So that's why in many countries there's a screening program for prostate cancer.
What age do they start doing prostate screening?
Screening in 55 to 60 varies in different countries, and if you have family history, then it needs to be started at an early stage.
So early stage, they need to go to the GP and tell them, or the GP will send them a letter?
In this country, you have to go to GP. It's not a universal screening program. So whenever somebody goes to a GP, they usually get their PSA checked.
Okay, let's talk a little bit about prostate enlargement. This is not the cancer. I haven't reached that, but just a benign, as a friendly enlargement of prostate.
That's right. So that's called benign enlargement prostate. That's why the word benign is used, because it's to separate from the cancer, because there are different pathways for management of these two diseases. So benign enlargement prostate causes a lot of symptoms to the patient. So symptoms, as we mentioned before, could be due to the constriction of the water pipe, so that they have difficulty passing urine, they don't empty the bladder completely, they have some dribbling after passing urine. And then there are the other symptoms which are going to be called the...
While we're talking, I'm going to tell, we will be getting ready with our a video, which is going, we're going to show a little bit about the cancer. And yeah, you can go ahead. I think when you finish talking, they will play the video.
Okay, fine. So the other symptoms, as we mentioned, was that the bladder becomes abnormal by working against resistance. So they call storage symptoms. So getting up in the night is another symptom of the enlarged prostate, and frequency of menstruation. So these are things people present with, and depending on how much care people take about their symptoms, they could present at an early stage or at a very late stage. And sometimes first presentation is when they can't pass urine. It's very painful, and they go into detention, and they have to have a catheter put in.
Catheter put in.
That's right.
Okay. Now we're going to look at a video. This is as an animation video. This is all about the prostate cancer, which is really well explained, and here they basically explain everything about the prostate cancer.
Considerations in advanced prostate cancer. Prostate cancer is the most commonly diagnosed cancer among men in the United States, excluding certain skin cancers. A common misperception about prostate cancer is that it is rarely fatal. In fact, it is the second leading cause of cancer-related death among men in the United States. While it is true that prostate cancer is largely curable when diagnosed and treated early, patients with advanced prostate cancer have a less favorable prognosis. Advanced prostate cancer is defined as cancer that has spread beyond the original tumor. The most recent statistics estimate that 3 out of 10 men are still alive 5 years after being diagnosed with advanced prostate cancer. Male hormones, such as testosterone, cause prostate cancer to grow and survive. Early treatments for prostate cancer attempt to lower levels of testosterone in the body. This is known as hormone therapy. However, prostate cancer tumors may eventually begin to grow again, even though levels of testosterone in the body are low. At this point, the cancer is considered to be advanced. Researchers are studying why this occurs to gain a better understanding of how to develop treatments for prostate cancer. Talk to your doctor about questions you may have about advanced prostate cancer. Recent basic science and medical evidence suggest that one possible reason that tumors continue to grow is that they become extremely sensitive to the low levels of testosterone that surround them. In this way, tumors can grow even though there are extremely low levels of testosterone in the bloodstream. Additionally, studies done in both animals and humans show that the tumor may begin to produce its own supply of testosterone. This means the tumor is capable of fueling its own growth. In other words, in advanced prostate cancer, there is evidence to suggest that the tumor may be providing its own testosterone so that it can grow without depending on other sources of testosterone production. Talk to your doctor about new information regarding advanced prostate cancer.
Tariq, let's talk a little bit about prostate cancer. We showed the animation, almost everything was there. Thank you for that video from YouTube, and the provider we're glad we could find that, and it's quite educational video. And by the way, what is this prostate cancer?
Prostate cancer is one of the, as you mentioned in your introduction, is one of the commonest cancer in men, and every year almost 50,000 men in the UK are diagnosed with prostate cancer. So, and 12,000 men die of prostate cancer every year in United Kingdom. So it is a common cancer, and that's why the consensus is to try to pick up these cancers at an early stage. So that they can be amenable to treatment. And not all cancers need treatment. That's the other important thing to remember, that we may diagnose some cancers and some cancers can be followed up. So the concept of active surveillance has come in.
Are there different kind of prostate
cancer? There are different
cancer?
types of cancers because they depend on what the grades are. The grades are assessed by the examination of tissues taken out on biopsies.
So you take biopsies?
We take biopsies, that's right. So now there's a 2-week wait pathway for prostate cancer. So within if somebody presents to a general practitioner with raised PSA or other symptoms, for example, an abnormal examination of the prostate done by a general practitioner, they'll be sent on a fast track.
Let's go through the pathway. Okay, let's say if somebody in that particular age, like 50s or 60s, they suspect this, they have a cancer. So first of all, they need to go to the GP.
That's right. The GP does a blood test first, and the PSA, the blood test which is done is called a prostate specific.
That's called PSA.
That's a prostate specific antigen. That means that this is only secreted by prostate. So if that goes up above a certain range,
so you do a blood test for that?
Well, that's a blood test, and we on one reading, if the reading is high, we repeat the blood test.
Right.
And if the second reading is high as well, then he's referred on a fast track to urological service, and within the patient has to be seen within 2 weeks. And then there are secondary pathways that within 31 days of being referred, the patient should have the diagnosis confirmed and whether he's being treated
within 21 days.
Within 31 days.
Yeah.
31 days, and it's being reduced with 62 days, then 31 days, and then it will be 21 days, so that they want to reduce the window from referral to diagnosis and treatment.
So that's because the cancer is quite dangerous.
They want to separate the dangerous cancer from the less dangerous.
They want to identify it quite early,
because that's right. In order to reduce the morbidity and mortality. Today we are talking about prostate and problems related to prostate. Our special guest on the show, Mr. Tariq Tasadak, is a urologist. So far we discussed the basics about prostate, what is it about, and a little bit about benign prostate enlargement, and we touched upon the cancer. We played a video as well, that's the animation about the cancer. Now, from now on, we're going to talk more about the treatment, what we could do for this prostate. So, ladies and men, don't go away. This is a really important program. You need to know all about this. In case if you missed the show, you could always watch us back on our Facebook page, or you could always watch us back on our special YouTube channel, Health Talk with Dr. Akram, and all the videos will be uploaded. And of course, we have all other the past programs are uploaded there. So keep an eye on it. And if you haven't subscribed, don't forget to subscribe. But anyway, Tariq, let's go. Oh, well, there is a caller. Let's get the caller on. Hello?
Hello.
Hello, welcome to the show, sir. What's your name, please?
Syed Ahmad.
Syed Ahmad, yes, please go ahead.
আমি বলতে চাচ্ছিলাম ডক্টর স্টুডিওতে বলছি Syed Ahmad.
So you want to talk in Bangla? What we do, I will let you talk to the studio. There are people who speak Bangla, and they will get your question. They will translate it to me, and then we'll come back to you. Is that all right? So don't switch off your phone, and you will get straight away. You connected to the control room, and they will handle your call. All right? Okay, Tariq, let's go. Benign enlargement.
Yes. So the thing is, obviously, you don't need to treat everybody with mild symptoms. First of all, if the problem is that they have to get up more frequently in the night, then we can start with, first of all, fluid modification, dietary modification, to ask them that they need to reduce fluid intake during the night.
So reduce fluid intake
during
in the night.
And obviously not to drink 2 to 3 hours before going to bed. So that may improve the symptoms. But before we do all of these, we just need to make sure that we are treating them safely. They've got no infections. We need to check the urine for infection, blood for PSA. Blood for kidney function are important because prostate, as I mentioned, can affect the
So
kidney
you need
function.
to take a couple of bloods.
A couple of blood tests, a urine test, and then
urine
a detailed
test.
history. And then there's a sort of a proforma which is available in GP surgery, which we call this International Prostate Symptom Score.
National Prostate Symptom Score.
IPSS, International Prostate Symptom Score, and then the score of bother. So we grade them for low score, which will only require some dietary modification or some general advice, to higher score, which is affecting the quality of life. In that case, they may need to be referred to a specialist for further investigations.
So simply they will go to the, so if you have these symptoms, you will go to the GP practice, and they will give you a sheet, and they're going to score according to your symptoms.
That's right.
And
secondly,
from they will decide
which ones to go and which
to go
ones
for.
to treat in the general practice. The important thing to remember is to rule out infection by checking the urine, rule out any prostate cancer by checking blood for PSA, and make sure the kidney function is normal.
kidney function is normal.
That's right. So, and if there's any infection, the GP will treat the infection accordingly. If
Right.
the PSA is on the higher side, then the patient will be fast-tracked on a cancer pathway.
Excellent.
And the kidney functions are abnormal, then obviously they need to be referred urgently. Maybe the prostate is causing obstruction to the kidneys.
So in the UK, when you advise our viewers to go and consult the GP about prostate, is there any age you would suggest for them to go? Or
The thing is,
they wait for the symptoms?
the symptoms, I mean, some people go through life without having any symptoms.
Symptoms.
Yes, so it's the symptomatic patients who will go there. But I mean, if you're going for the prostate screening, then obviously that's a different issue.
So prostate screening.
Prostate screening for cancer is a different issue altogether. But for benign changes, obviously it depends on your symptoms.
So there's not every man has to go through this prostate screening at some point in their life.
No, I mean,
We
not-
don't
not
have
in-
that
not
yet.
in the UK.
Okay, that's fine. Okay, let's talk about the cancers. What can we do for these cancers? What kind of?
Obviously the first thing is that the cancers have to be caught at an early stage because there are excellent treatments available, and patients can be cured of the prostate.
So this cancer is curable.
It is curable. It's if caught at an early stage, and once the prostate is gone, spread outside the prostate, then obviously there's a palliative care available with medication, hormone manipulation, and the chemotherapy. So the aim of the screening program is to pick up cancers, which require treatment, and ones which require treatment should be treated in an early stage, so that they can have an excellent outcome. So and the treatments available, the figures usually are this: once patient is diagnosed with prostate cancer, and it's assessed by the clinicians and by the multidisciplinary team meeting, because all new prostate cancers go through multidisciplinary meetings, which include.
Who are in this team? In
that team, there's a urologist, there's a radiologist, there's a medical oncologist, there's a radiation oncologist, and histopathologist. So they all sit down together. They look at all the cancers individually, so that all patients have a tailored treatment according to their cancer characteristics. So somebody with a low-grade cancer can be observed, with somebody with a high-grade cancer may need treatment immediately. So that's where the treatment decisions are made. Then these are communicated to the patients, and then patients are given a choice. For example, nowadays there's not much to choose between radical surgery and radical radiotherapy. So one patient may have personal preference for one choice or the other. So they can see both specialists, and then they can decide on their own.
Okay, well, Tariq, the caller actually is about. It's not. I don't think it's related to prostate anyway. He had a shoulder pain for 2.5 months. Right. What can he do?
Right. Obviously, shoulder pain. The first thing is that whether there is a history of.
So he was given codeine, and
Right.
once he had codeine, he was sweating a lot as well.
Right, okay. Obviously, he needs to be seen by a general practitioner to see whether it's what sort of shoulder problem he has, whether it's a rotator cuff or a joint problem. So he needs to be properly assessed by a physician. So on the phone, we can't give the appropriate treatment because all medicines come with the baggage and they have side effects. So best thing would be to see or make an appointment to see your general practitioner who can examine you and then advise you treatment accordingly.
Right. So you are telling that it can be a orthopedic problem.
That's right. It could be.
He has to go.
Muscle problem. It could be one of many things. So that's why first thing is to take a detailed history and then examination.
Yeah. So it is a very good question. It's very important for this person who is calling us. It must be in agony. His shoulder pain. So it's quite bad.
Quite disabling, especially somebody who's in the working age group.
Yeah, but unfortunately, we won't be able to sort out from here, isn't it? Because you have to physically see the patient.
Absolutely.
So they have to go through the GP, and if GP thinks that the problem is bad, he will refer to an orthopedic surgeon,
or may need an X-ray or other.
And may need an X-ray or investigation. Hope that answers his questions. Okay. Let's go back. And what kind of diet is good for prostate?
There's a lot of literature on the diet. Some people would say that avoid red meat, which in some studies they found that it could be, more liable to get cancer from eating more red meat.
So red meat, avoid red meat?
Red meat. A lot of people would say there's certain vegetables and pumpkin seeds and other things that are good for prostate health. But there's no conclusive evidence one way or the other. There are no controlled studies, and it's very difficult to do a dietary study. But all people would recommend that stick to a balanced diet and a nutritional diet.
So the best thing is to have a balanced diet. Don't eat
Absolutely.
too much of meat. Don't eat too much of something else.
Absolutely.
Is alcohol drinking? Is there anything to relate to?
Alcohol can aggravate the symptoms because obviously we used to call it Friday night syndrome. People who had
Friday night syndrome.
People who had prostate problems, and I remember when we were junior doctors, people used to get wages on a Friday. So elderly men would go and spend some time in the pub, have a lot of drink, and the bladders get filled up. And with the alcohol, they didn't have the desire to empty the bladders. On the way back home, they couldn't pass any urine. So in the Friday night, a lot of people were coming to A&E with retention of urine.
So it's Friday night syndrome.
It used to be called Friday night syndrome, but nowadays you don't get paid on a Friday. It's a monthly pay, so it goes to your bank. So we don't see those problems anymore.
Probably with COVID as well, they can't go much to the pubs,
things are much better now.
Things are much better.
Yeah, but alcohol does aggravate the symptoms of frequency, urgency, and nocturia.
So alcohol, isn't it?
Yes,
what about smoking?
Smoking has got no direct relation.
relation
to the prostate.
Most of them, I ask all my speakers, and I ask, smoking, yes, yeah, always. But of course, there's a good news.
Although smoking is bad for you, but we can't, put a hand on our heart and say that smoking causes prostate problems.
Right. So that's that. And what can they drink?
The thing is, if they have a problem with going to the toilet more frequently or getting up in the night, then it's better to avoid the caffeinated drinks like tea and coffee. They should modify their tea and coffee intake.
So don't drink too much by afternoon. Probably stop it, is it?
Stop it, especially and in the evening if you're more worried about getting up in the night. So avoid caffeinated drinks in the evening and late.
I just remember even my father has all these symptoms. He's 80 plus 84 now, I think, and he has all these symptoms. He's got frequency, he goes to the toilet a lot, but with his health condition, it's difficult to operate or anything.
Right. So that's fluid modification may be the best thing, but
fluid modification
is very important.
He drinks a lot of tea.
Yeah, that's something that needs to be looked into, and if we can be convinced.
Yeah.
So he's done very well on tea. I mean, he's 84. I mean, you're saying so. You can't stop him from enjoying his life.
Enjoying his tea as
That's
well. Okay. Well, there's a lot of talk about herbal treatments and prostagenics and all other things.
That's right. There are.
popping
I
up
mean,
all
the pumpkin seeds, saw palmetto. There are many treatments, prostate off-the-counter treatments available.
I think half of the whole and Barrett sell
full of prostate
drugs.
That's saw palmetto. Saw palmetto is one of the main ones, and then the pumpkin seeds are.
So what can you tell again? What is good for prostate problems?
As I mentioned earlier, there is no study which is conclusive. But I mean, it's symptomatic. Patients may have, it's an old wives' tale as well. So some people may get benefit from one tablet or the other. So they can say, look, I've been eating pumpkin seeds or
seeds.
Saw palmetto. There is another herbal medication.
Saw palmetto. Okay.
Yes, and these are the things which do help with our symptoms. So I mean, if somebody's psychologically being cured or it has a placebo effect, so there's at least there's no harm to these medications.
The placebo effect is a good one, is because the brain thinks it is working and the body works.
Right, absolutely.
It's the central processor and it controls everything.
Definitely.
So it's not they are mad that placebo works. It's known in scientific
It has
facts.
scientific basis, yes.
So herbal treatments. Are there any tablets in herbal tablets?
I mean, there are treatment, the medication. There are two types of medication, two groups which we give for the benign enlargement of prostate. One is which is like the blood pressure medication, which relaxes the muscles inside the prostate. So when the muscles are relaxed, the valve is relaxed and the flow of urine is increased.
So you give a blood pressure medicine for that.
It's similar to blood pressure. It started with like Hytrin, that was the medication, but they found out there's more specific medication which block the alpha blockers, which we call the different groups of it. So they're helpful. And if the prostate size is much bigger, then there's a 5-alpha reductase inhibitors. So that these are hormones, these are medication which prevent the conversion of testosterone into active metabolites. So basically they're starving the prostate of active metabolites of testosterone. So it is over the period of time, it reduces the size of prostate, it reduces the vascularity of the prostate. And for large prostates over 45-50 grams, they are found more helpful, more useful than the alpha blockers. And sometimes you can use it in combination as well.
So what is this treatment? Well, how do you call it?
It's one tablet a day. It's finasteride or dutasteride.
Okay.
And they stop the conversion of testosterone into active metabolite, which promotes the growth of prostate cells.
So the prostate does not grow after these tablets. So will it help with the prostate cancer as well, or is it just for
it doesn't. It doesn't. I mean, there are some studies going on, but I mean, it doesn't. It hasn't proven to be beneficial in the prostate cancer.
So prostate cancer, they have to go through the surgical or radiotherapy or chemotherapy.
Absolutely, these are the different treatments are available.
Right.
So I mean, for an early prostate cancer, which has got a high grade, they grade the cancers from. There's a technical term they call it Gleason grades. Gleason from 6 is the best one and 10 is the worst one. So there's a spectrum between.
So they grade the prostate cancer
according to the appearance of the cells or cancer cells under the microscope, and it's according to the type of glands they form. So they can grade from a cancer which will have a relatively benign course. They grade it near the 6, and then the other one is the most dense spectrum is 10. So they're in between as well.
So a friendly cancer is 6. A bad cancer is 10.
That's right. So and in between there are different spectrums. So you start treating from 7 onwards. So below 7 you can keep an observation. Or
so as you say, it's not all the cancers you need to treat, isn't it?
That's right. Yeah, that's something which has been picked up recently. Initially, when the prostate cancers started getting picked up in 80s and 90s, all patients were going through treatment option. Then in some Canadian studies revealed that not all cancers need treatment.
Not all cancers.
That's right. Some people.
And not all cancers will kill you as well.
That's right. Absolutely. You can die with cancer, but not of cancer. So that's the term that we use for the prostate cancer.
That's quite interesting, isn't it? A lot of people think when they have a cancer, think that's the end of the life. Yes, but it is not, isn't it? No, prostate cancer is quite
it's very
well treatable, and the breast cancer is quite similar as well, isn't it?
Yes.
If they catch early in stage, they could live for years.
Absolutely.
That's amazing. That's a great medical advancement. I think we are facing with. Okay, we talked about diet and we talked about herbal treatments, food and lifestyle. We talked about medical treatment. And what do you do by chemotherapy? When do they decide you're going to give a chemotherapy or radiotherapy?
Chemotherapy is for prostate cancer which have not responded to radiotherapy, or they have got what you call metastatic disease, which is spread outside the confines of the prostate.
So if it is spread outside the
right.
prostate, you give a chemotherapy. Because
chemotherapy, normally they start with the hormone therapy. They deprive the prostate cancer of testosterone, which is the main hormone, male hormone, which the prostate cancer cells thrive on. And unfortunately what happens is that after a certain period of time, the cells, prostate cancer cells, which are not hormone responsive, will not stop responding, and then they can continue to grow.
Right.
But then they have to give to second line treatment or third line treatment.
Tariq, we talked about this cancer can spread to some other part of the body. Right. What is a common place they spread?
They spread to the bones. They can.
So bone cancer?
The prostate cancer has a relation to go to bones. It goes to the glands around the big vessels, which called lymph glands.
So lymph nodes, lymph
and
glands.
Then they go into the surrounding organs. They can go into the bladder. They can go into the rectum. They can go into the organ. So
it can grow as well around
locally,
there
and
to rectum and bladder.
Through the bloodstream, they have a propensity to go for the bones. And when we stage the cancer for treatment, we look at the bone scan to make sure that they're not affected.
It has an invader.
That's right.
Yeah. So that's interesting. I think we will be getting ready for another video. This is all about the surgery. Until they get ready, we'll keep talking.
That's right. We can go through the surgical options for benign enlargement of prostate.
Yeah,
not,
that's right.
Not all patients respond to the medication. And sometimes they go into retention, and which is not settling down with the medication. So then there are options of surgical treatment. The standard treatment used to be a transjudicial resection of prostate, in which what we call is like an apple coring. We put a telescope through the water pipe.
Okay.
And make a core the inside of the prostate, and then take the chips out from the same tube. So basically we made the cavity larger so that the obstruction is gone and patient can pass water easily. But that's a major operation. There are certain alternatives to it as well now. They're using staplers to staple the prostate, and then there are ice treatments, and there are DSM, and there are many other treatments available.
Right, okay. Let's look at this video and see how we can do surgery without the surgeon. Of course, the surgeon is there, but the robot is operating. It's Da Vinci robot. Actually, I have been working with this robot for last maybe 10 years or more than that. It's been there for a long time, isn't it? And we use it on prostate surgeries as well.
That's right, yes. It started with the prostate surgery, and now other specialties are using it as well.
Specialty, yeah, that's right, yeah. So it is quite good access, isn't it, with this
It is, and it's very
surgery.
patient friendly, because the incisions, there is no big incision.
The Da Vinci surgical system is a state-of-the-art medical device comprised of a surgeon console and a patient-side robotic system with a high-resolution camera and micro-instruments used in surgery. The computer-enhanced system scales the hand movements of the surgeon at the console down to micro-movements of the surgical instruments on the patient-side system. Unlike standard laparoscopic instruments, the specialized Da Vinci instruments can articulate and rotate 360 degrees with unparalleled precision and flexibility. The camera of the system provides the surgeon with a remarkably clear, three-dimensional view inside the body. Looking inside the pelvis, the anatomy around the prostate consists of muscles and delicate nerves that affect both urination and erections. During the removal of the cancerous prostate, Your surgeon works to spare these very delicate structures, utilizing the articulating Da Vinci instruments and a highly magnified 3D view of the anatomy provided by the system. This added control and precision may assist the surgeon in preserving the anatomy necessary for urinary continence, as well as the nerve bundles responsible for erections. Once the prostate is cleanly detached, the prostate is then removed through a small incision. The bladder is reattached to the urine channel over a catheter. This catheter is left in place for a short period of time to ensure proper healing. The surgery is completed with the removal of the instruments and the closure of the small incisions in the abdomen. Prior to Da Vinci prostatectomy, the conventional approach to removing the prostate gland required a large open incision in the lower abdomen. With the advent of this new procedure, recovery time is quicker, and the patient enjoys significant benefits that change the experience of surgery.
Tariq, let's talk about TURP.
Right.
TURP, or is
So
it
that-
transurethral resection of prostate?
Absolutely. So this is the procedure which was popularized in America in 1950s. And before that, all the prostate procedures were done through an open incision, and which has got a lot of morbidity.
So before they did open incision.
That's right,
So
open
this
incision.
this one does not have an incision. You
This
can't
does
see
not
from
have its
outside.
incision. So what used to happen is they did open operation, then a lot of complications, bleeding. I mean, in some series there was 20%, 10 to 20% mortality.
The
with open-
mortality was 20%. That's a
with
lot.
open operation, because sometimes you could not control the bleeding when you took the prostate out.
So they had to open through the
through the abdomen.
Abdomen
and
and reach the
sometimes they
prostate.
either went through the bladder or just below the bladder. So there are different transvesical. There was one approach, and then the other was retropubic, which was popularized in Ireland.
Right.
The 10th century. So then they started looking at when the optics got better, and the endoscopes and the camera systems got better.
So you passed a camera through the male.
Male water pipe, the telescope
pipe.
goes there.
Yeah.
Then there's a hot wire which goes along.
So this has a small microscope inside, isn't it?
It's a sort of what you call a resectoscope.
Resectoscope.
It's got a hot wire.
And a hot wire.
Hot wire with like a cheese cutting. So it goes in there. So it with the high temperature, it takes slivers off the prostate.
Prostate, that's
So
right.
these all slivers, they go into the bladder first, then they're washed out of the bladder. So there's no open incision, and patient can go home in 1 or 2 days, and the catheter can be taken out in a couple of days' time. So you do the same thing, reduce the size of the prostate, open the channel as you would do with an open operation, but without having an incision or cutting into the abdomen or into the bladder. So the morbidity is much less. And
So morbidity is much less, yeah.
And obviously the patient comfort is very good. And with the new machines, I mean, patient can go home the same day or the next day. And then they've gone further on it. For example, for big prostates, instead of using the TURP, they use laser, and there's a procedure called HOLIP, which is called holmium.
Laser, yeah.
It's called holmium laser enucleation of prostate. So the principle is the same. But what they do is they enucleate all the prostate as we would do with an open operation up to the capsule. Then they push the prostate inside the bladder, and then they use a special morcellator inside the bladder to take the chips out.
Chips out, right.
So you can deal to up to 300, 350 grams prostate can be taken out through the same route. But before that, it used to be an open operation, and it's a big undertaking.
So basically we pass this small probe through the
telescope,
telescope.
Through the water pipe, through
And
the urethra.
You could see in the camera,
That's right.
in the screen, the prostate,
Prostate
isn't it? The
lobes,
prostate
yes.
enlargement.
Prostate lobes,
Actually, I was working on prostate. Actually, Monday I was doing a surgery, and my patient had a spinal anesthetic, so he was anesthetized from waist below, and was his request as well. It's one of the best one for this kind of operations, and he wanted to watch the operation. So I put the screen up between him and the surgeon, and we had two two TV screens, and one the surgeon could watch, and the other one I turned to the patient. So he was lying down, he was watching his own operation.
That's right.
And he
right.
found it was really amazing experience. He
Absolutely.
said it's perfectly fine, and because he had this anesthetic, he didn't feel anything down, and he probably didn't even sense that they were operating on him. And he was watching through this operation. Do you experience
the way
like that?
we do, we do some, there's a console, the anesthetic console, which can be turned towards the patient.
Okay. Do you want to say any message for...
The message for all the audience, especially the men, is that prostate problems are very common. They're very much amenable to treatment. So try to seek attention early rather than late, because with delay, even if it's for a benign disease, it can cause more complications. So if you have any difficulty passing urine, getting up in the night, or any pain in that area, you should seek attention earlier.
Get help.
Get help.
Tariq, amazing. Thank you very much for a great show.
And
we
thank
really
you much for
enjoyed.
inviting me over, and I look forward to coming here again. Thank you, Akram.
Thank you very much. And by the way, thank you for all of you staying with us and listening to this amazing program. And we have given lots of information all about prostate and prostate related problems. It is very common, especially in men at certain age, and even ladies. This is really important for you to know and to diagnose if it's around in your family. So if you have missed this program, you can always watch on our Facebook Live on INTV website, or you could always watch this program in Health Talk with Dr. Akram YouTube channel. And please keep an eye out. By now, anyway, thank you for staying with us on Iron Health Talk with Dr. Akram. If you have any further questions, please email us healthtalk@intv.co.uk or message us on our dedicated YouTube channel, Health Talk with Dr. Akram, or Facebook, Twitter, Instagram, and we'll of course respond as soon as we can. But for now, goodbye and keep yourself safe. Oh, by the way, next week we're going to talk about diabetes, so keep an eye. Thank you very much. Bye-bye.